Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 50 practice NCLEX questions. Without the way, let's get started.
A client admitted to the hospital with peptic ulcer disease tells the nurse about having black tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Report the finding to the healthcare provider. Black tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digested blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digested blood. Until other information is available, it is not necessary to initiate contact precautions. The nurse teaches the client who has had rectal surgery the proper timing for sitz baths. The client has understood the teaching when the client states that it is most important to take a sitz bath. 1. First thing each morning. 2. As needed for discomfort. 3. After a bowel movement. 4. At bedtime. The correct answer is 3. After a bowel movement. Adequate cleaning of the anal area is difficult but essential. After rectal surgery, sitz baths assist in this process, so the client should take a sitz bath after a bowel movement. Other times are dictated by client comfort.
When a patient is being prepared for a colonoscopy procedure, which task is most suitable to delegate to assistive personnel? 1. Explaining how to assume the side-lying position. 2. Reinforcing the need for a clear liquid diet. 3. Administering laxatives as needed. 4. Administering an enema to prepare the bowel. The correct answer is 2. Reinforcing the need for a clear liquid diet. Rationale. The AP can reinforce dietary and fluid restrictions after the nurse has explained the information to the patient. Teaching the patient about what to expect is the nurse's duty. An enema is not typically part of the bowel prep, but might be ordered if the bowel is not empty or well visualized. The AP may administer enemas with special training and under certain circumstances, such as home care, but in this situation it is unlikely that this task will be delegated to the AP. Medication administration should be performed by the nurse.
Nursing practice is influenced by the doctrine of respondite superior. Which is the basic concept related to this theory of liability? 1. Nurses must respond to the Supreme Court when they commit acts of malpractice. 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. 3. Nurses are responsible for their actions when they have contractual relationships with clients. 4. The law absolves nurses from being sued for negligence if they provide inappropriate care at the scene of an accident. The correct answer is 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. The ancient legal doctrine respondite superior means let the master answer. By virtue of the employer-employee relationship, the employer is responsible for the conduct of its employees. This is unrelated to respondite superior. Negligence and malpractice, which are unintentional torts, are litigated in local courts by civil actions between individuals. Individual responsibility is unrelated to respondite superior. A nurse can have an independent contractual relationship with a client. When a nurse works for an agency, the contract between the nurse and client is implied. In both instances, the nurse is responsible for the care provided. This is unrelated to respondite superior. Good Samaritan laws do not provide absolute immunity. Nurses must function as a reasonable, prudent nurse would function in a similar situation. Nurses can be held responsible if there is gross departure from the normal standard of care or if there is willful wrongdoing on the nurse's part.
For a patient with short bowel syndrome, the nurse would question the prescription of which enteral formula? 1. High sodium content. 2. High fat content. 3. High protein content. 4. Modified carbohydrate content. The correct answer is 2. High fat content. Rationale. Patients with short bowel syndrome have impaired fat absorption as a result of limited surface area. Formulas with high sodium content would not be prescribed for heart failure. High-protein formulas can contribute to dehydration if adequate water is not given. Modified carbohydrate content is prescribed for patients with chronic obstructive pulmonary disease when they require nutritional support.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client is scheduled for a percutaneous transluminal coronary angioplasty to treat angina. Priority goals for the client immediately after PTCA should include 1. Minimizing dyspnea. 2. Maintaining adequate blood pressure control. 3. Decreasing myocardial contractility. 4. Preventing fluid volume deficit. The correct answer is 4. Preventing fluid volume deficit. Rationale. Because the contrast medium used in PTCA acts as an osmotic diuretic, the client may experience diuresis with resultant fluid volume deficit after the procedure. Additionally, potassium levels must be closely monitored because the client may develop hypokalemia due to the diuresis. Dyspnea would not be anticipated after this procedure. Maintaining adequate blood pressure control should not be a problem after the procedure. Increased myocardial contractility would be a goal, not decreased contractility.
A client with terminal cancer is willing to try new therapies. Which stage of Kubler-Ross stages of grieving does the nurse identify that the client is experiencing? 1. Denial. 2. Depression. 3. Bargaining. 4. Acceptance. The correct answer is 3. Bargaining. Rationale. A client in the bargaining stage of grieving seeks to avoid the loss and will try new therapies to gain more time.
The patient needs diagnostic testing to confirm symptoms of peptic ulcer disease, and a healthcare provider tells the nurse that the patient prefers non-invasive methods. Which brochure is the nurse most likely to prepare for the patient? 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. 2. How your doctor uses a barium contrast study to detect peptic ulcer disease. 3. Esophagogastroduodenoscopy, the major diagnostic test for peptic ulcer disease. 4. Common questions and answers about nuclear medicine scans. The correct answer is 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. Rationale. H. pylori is frequently associated with peptic ulcer disease, and the organism can be detected through breath, blood, or stool. Esophagogastroduodenoscopy is the best test for peptic ulcer disease. However, it is considered an invasive procedure. A barium contrast study may be ordered for a patient who cannot undergo an endoscopy. A nuclear medicine scan may be ordered if gastrointestinal bleeding is present or to detect gastric emptying disorders.
A client with angina is taking nifedipine. The nurse should teach the client to 1. Monitor blood pressure monthly. 2. Perform daily weights. 3. Inspect gums daily. 4. Limit intake of green leafy vegetables. The correct answer is 3. Inspect gums daily. Rationale. The client taking nifedipine should inspect the gums daily to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weights or limit intake of green leafy vegetables.
The client is admitted to the telemetry unit diagnosed with acute exacerbation of congestive heart failure. Which signs and symptoms would the nurse expect to find when assessing this client? 1. Apical pulse rate of 110 and 4 plus pitting edema of feet. 2. Thick white sputum and crackles that clear with cough. 3. The client sleeping with no pillow and eupnea. 4. Radial pulse rate of 90 and capillary refill time less than 3 seconds. The correct answer is 1. Apical pulse rate of 110 and 4 plus pitting edema of feet. The client with congestive heart failure would exhibit tachycardia, dependent edema, fatigue, third heart sounds, lung congestion, and change in mental status. The client usually has pink frothy sputum and crackles that do not clear with coughing. The client would report sleeping on at least 2 pillows, if not sleeping in an upright position, and labored breathing, not eupnea, which means normal breathing. In a client diagnosed with heart failure, the apical pulse, not the radial pulse, is the best place to assess the cardiac status. In option 3, the word no is an absolute term, and usually absolutes, such as no, never, always, and only, are incorrect because there is no room for any other possible answer. If you're looking for abnormal data, then you should exclude the options that have normal values in them, such as eupnea, pulse rate of 90, and capillary refill time less than 3 seconds.
For the postoperative care of a morbidly obese patient, which task best utilizes the expertise of the LPN/LVN under the supervision of the RN team leader? 1. Obtaining an oversized blood pressure cuff and a large-size bed. 2. Setting up a reinforced trapeze bar. 3. Assisting in the planning of toileting, turning, and ambulation. 4. Assigning tasks to assistive personnel and other ancillary staff. The correct answer is 3. Assisting in the planning of toileting, turning, and ambulation. Rationale. The LPN/LVN can offer valuable assistance in planning the interventions, but the RN has ultimate responsibility for the care plan. The LPN/LVN can delegate and assign tasks to APs. However, if the RN is a team leader, it is better if APs are not receiving instructions from multiple people. Obtaining equipment should be delegated to an AP. A physical therapist should set up specialized equipment.
The client newly diagnosed with epilepsy is prescribed an anticonvulsant medication. Which information should the nurse tell the client? 1. The medication dosage will start low and gradually increase over a few weeks. 2. The dosage prescribed initially will be the dosage prescribed for the rest of your life. 3. The HCP will prescribe a loading dose and decrease dosage gradually. 4. The dose of medication will be adjusted monthly until a serum drug level is obtained. The correct answer is 1. The medication dosage will start low and gradually increase over a few weeks. Rationale. Anticonvulsant dosages usually start low and gradually increase over a period of weeks until the serum drug level is within therapeutic range or the seizures stop. It is incorrect to state that the dosage prescribed will be the dosage for the rest of the client's life, but it is correct to state that the client will most likely be on the medication for the rest of his or her life. The medication is started in low dosages and gradually increased. The dose of medication will be adjusted until a serum drug level is reached, but it will be more frequently than monthly.
The nurse is assessing the client diagnosed with congestive heart failure. Which laboratory data would indicate that the client is in severe congestive heart failure? 1. An elevated B-type natriuretic peptide. 2. An elevated creatine kinase. 3. A positive D-dimer. 4. A positive ventilation perfusion scan. The correct answer is 1. An elevated B-type natriuretic peptide. BNP is a specific diagnostic test. Levels higher than normal indicate congestive heart failure, with the higher the number, the more severe the CHF. An elevated CKMB would indicate a myocardial infarction, not severe CHF. CKMB is an isoenzyme. A positive D-dimer would indicate a pulmonary embolus. A positive ventilation perfusion scan would indicate a pulmonary embolus.
In which case would fecal microbiota transplantation be considered for a patient with Clostridium difficile infection, CDI? 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. 2. Patient has CDI and a healthy donor who meets the criteria for donation is available. 3. Patient has had a recurrence of CDI after receiving a full course of metronidazole. 4. Patient has many risk factors for CDI and has poor nutritional and fluid reserves. The correct answer is 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. Rationale. FMT is considered after the failure of medication therapy and after multiple recurrences. Vancomycin or fidaxomicin is the first-line therapy. Rifaximin is an adjunctive post-vancomycin treatment regimen for patients with recurrent CDI. Previously, metronidazole was considered a first-line treatment. However, it is now used only when vancomycin or fidaxomicin are not an option for the patient.
The client diagnosed with a stroke has been prescribed phenytoin. Which statement explains the scientific rationale for prescribing this medication? 1. The client's stroke was caused by some damage to cerebral tissue. 2. The stroke caused damage to the brain tissue that could result in seizures. 3. Hemorrhagic strokes leave residual blood in the brain that causes seizures. 4. This medication can help the client with cognitive deficits think more clearly. The correct answer is 2. The stroke caused damage to the brain tissue that could result in seizures. Rationale. Stroke caused loss of function in areas of the brain leads to a problem with nerve impulse transmission. This blocked transmission can initiate a seizure. Phenytoin is an anticonvulsant. Strokes cause damage to the cerebral tissue. The brain does not cause the damage to itself. If the client survives a hemorrhagic stroke, the body will reabsorb the blood. There should not be any residual blood. Anticonvulsants do not increase cognitive ability.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client diagnosed with chronic hypertension is prescribed furosemide and enalapril. The client's blood pressures for the last 3 weeks have averaged 178/95, and the HCP has added atenolol to the client's current medication regimen. Which statement is the scientific rationale for including this medication in the client's regimen? 1. Achieving a lower average blood pressure will help to prevent a stroke. 2. The other medications are not effective without the addition of atenolol. 3. The atenolol will potentiate the effects of loop diuretics. 4. The HCP will taper off the enalapril and eventually discontinue it. The correct answer is 1. Achieving a lower average blood pressure will help to prevent a stroke. Rationale. Hypertension is a risk factor for developing a stroke. Some clients require multiple medications to control their hypertension. If option 2 was true, then atenolol would be the only medication the client needs. Beta blockers are frequently used in combination with other antihypertensive medications to control a client's blood pressure. Atenolol, a beta blocker, does not potentiate the effectiveness of loop diuretics. Beta blockers, not ACE inhibitors, enalapril, must be tapered off when discontinuing them to prevent rebound cardiac dysrhythmias. The HCP is adding the beta blocker to the current medications.
Which cardiac enzyme would the nurse expect to elevate first in a client diagnosed with a myocardial infarction? 1. Creatine kinase. 2. Lactate dehydrogenase. 3. Troponin. 4. White blood cells. The correct answer is 3. Troponin. Troponin is the enzyme that elevates within 1 to 2 hours. CPKMB elevates in 12 to 24 hours. LDH elevates in 24 to 36 hours. White blood cells elevate as a result of necrotic tissue, but this is not a cardiac enzyme. You should be aware of the words cardiac enzyme, which would eliminate option 4 as a possible answer. The word in the stem is first. This question requires you to have knowledge of laboratory values.
The nurse is caring for a patient with cirrhosis and portal hypertension. Which statement by the patient is cause for greatest concern? 1. I'm very constipated and have been straining during bowel movements. 2. I can't button my pants anymore because my belly is so swollen. 3. I have a tight sensation in my lower legs when I forget to put my feet up. 4. When I sleep, I have to sit in a recliner so that I can breathe more easily. The correct answer is 1. I'm very constipated and have been straining during bowel movements. Rationale. Portal hypertension increases pressure in the venous system and contributes to the development of esophageal varices, which are very fragile. Straining increases thoracic or abdominal pressure, which can cause a sudden rupture of fragile blood vessels with massive hemorrhage. The patient could have fluid accumulation in the abdomen that may be mild and hard to detect or severe enough to cause orthopnea. Patients will compensate for orthopnea by assuming a more upright position. This symptom warrants additional investigation. Dependent peripheral edema can also be observed but is less urgent. Generally, respiratory issues are the priority. However, this question calls for knowledge of pathophysiology of cirrhosis and portal hypertension. Rupture with hemorrhage is the most serious complication. A nurse is caring for several children on a pediatric unit. Children in which age group should the nurse expect will be most unstable and challenging with regard to the development of a personal identity? 1. Toddlerhood. 2. Adolescence. 3. Childhood. 4. Infancy. The correct answer is 2. Adolescence. Rationale. Adolescence, 12 to 20 years. Identity versus role confusion, have more multiple and complex milestones than individuals in any other stage of development. These milestones are physiological, psychological, and social. The multiplicity of these stressors can have a major impact on the development of the adolescent's personal identity and sense of self. Although toddlers, 18 months to 3 years, early childhood, autonomy versus shame and doubt, experience a number of developmental milestones, toddlerhood is not as unstable or complex as another stage of development. Toddlers explore and test the environment, develop independence, and have a beginning ability to control the self. Although children in early childhood or toddlerhood, 18 months to 3 years, autonomy versus shame and doubt, and late childhood, 3 to 6 years, initiative versus guilt, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of childhood are achievement of self-control, initiation of one's own activities, and development of purpose and competence. Although infants, birth to 18 months, trust versus mistrust, experience a number of developmental milestones, their development is not as unstable or complex as that of another age group. The main tasks of infancy are to adjust to living in and responding to the environment and to develop trust. A school nurse is teaching a class of adolescents about nutrition. Which age group should the nurse identify as having the highest energy expenditure and nutrient requirements? 1. End of the life cycle. 2. Middle adult years. 3. Early adult years. 4. First year of life. The correct answer is 4. First year of life. Rationale. During the first year of life, nutritional needs per unit of body weight are the greatest in comparison to any other time during the lifespan. Birth weight generally doubles in 4 to 6 months and triples by the end of the first year. Older adults experience decreases in basal metabolic rate, lean body mass, and physical activity that contribute to a decrease in caloric needs. Energy expenditure decreases, and nutritional needs stabilize during the middle adult years. People in other age groups have greater needs for nutrients to meet physiological demands than do those in the middle adult years. Although young adults tend to be active and require nutrients adequate to meet high energy expenditure, physical growth slows and the basal metabolic rate begins to stabilize, so they require fewer calories than do other age groups. Which common physiological change associated with aging should the nurse assess for an older adult? Select all that apply. 1. Increase in sebaceous gland activity. 2. Deterioration of joint cartilage. 3. Loss of social support system. 4. Decreased hearing acuity. 5. Increased need for sleep. The correct answers are 2. Deterioration of joint cartilage, and 4. Decreased hearing acuity. Rationale. Older adults generally experience a deterioration of the hyaline cartilage surface of joints, which tears, allowing bones to be in direct contact with each other. Often, this results in the formation of spurs or projecting points that limit joint motion. Hearing acuity decreases, particularly in relation to high-pitched sounds, because of atrophy in the organ of chordae and cochlear neurons, loss of sensory hair cells, and degeneration of the stria vascularis. Although sebaceous glands increase in size with age, the amount of sebum produced decreases, hastening the evaporation of water from the stratum corneum and resulting in cracked, dry skin. Loss of a social support system is a psychosocial, not physiological, change commonly experienced by older adults. Older adults have the same need for sleep as younger individuals. However, it is more difficult for older adults to obtain the quality and quantity of sleep desired. Chemical, structural, and functional changes in the nervous system disrupt circadian rhythms and sleep. A nurse identifies which word is being related to a principle of growth and development. Select all that apply. 1. Predictable. 2. Sequential. 3. Integrated. 4. Complex. 5. Static. The correct answers are 1. Predictable, 2. Sequential, 3. Integrated, and 4. Complex. Rationale. Growth and development comprise an orderly process that follows a predictable path. There are 3 predictable patterns. Cephalocaudal, proceeding from head to toe, proximo-distal, progressing from gross motor to fine motor movements, and symmetrical, both sides developing equally. Growth is marked by measurable changes in the physical aspects of the life cycle, and development is marked by behavioral changes that occur because of achievement of developmental tasks and their resulting functional abilities and skills. Growth and development follow a sequential timetable whereby multiple dynamic changes occur in a systematic and orderly manner. Individuals grow and develop in the physiological, cognitive, psychosocial, moral, and spiritual realms in an integrated way, with each one influencing the others. Growth and development comprise a complex process that involves multiple influencing variables, such as genetics, experience, health, culture, and environment. The word static means stationary, stagnant, or fixed. Growth and development are dynamic and progressive. A nurse identifies that an adult has an unresolved developmental conflict associated with adolescence. Which behavior supports this conclusion? Select all that apply. 1. Being overly concerned about following daily routines. 2. Requiring excessive attention from others. 3. Relying on oneself rather than others. 4. Failing to express a sense of self. 5. Lacking goals in life. The correct answers are 4. Failing to express a sense of self, and 5. Lacking goals in life. Rationale. A main developmental task of adolescence is being capable of determining who you are. An inability to express a sense of self later in life reflects an unresolved conflict of identity versus role confusion. A main developmental task of adolescence is forming a sense of personal identity as a foundation for the tasks of young adulthood, making decisions regarding career choices, and selecting a mate. An adult who has difficulty setting goals in life indicates an unresolved conflict of identity versus role confusion. 1. This relates to Freud's anal stage of development. According to Freud, if a parent is strict, overbearing, and oppressive during toilet training, the child may develop traits of an anal retentive personality. Seeking excessive attention from others is most likely the result of an unresolved task of the 6 to 12-year-old age group, industry versus inferiority. Seeking attention often is an attempt to increase self-esteem. People who have difficulty accepting help from others, or who would rather do things themselves, generally have not completely resolved the developmental task of infancy. Trust versus mistrust. An older adult patient tells the home health nurse that she is taking methylcellulose for chronic constipation. Which behavior is cause for greatest concern? 1. Patient primarily eats white bread and drinks low-fat milk. 2. Patient takes the methylcellulose 3 or 4 times a day. 3. Patient takes the medication with a few sips of water. 4. Patient does not promptly act on the urge to defecate. The correct answer is 3. Patient takes the medication with a few sips of water. Rationale. Methylcellulose can cause esophageal obstruction if taken with insufficient amounts of fluid. Intestinal obstruction is also a possibility if the passage is slowed or impeded. The patient should be reminded that 3 times a day is the acceptable dose range. High fiber and a prompt response to the urge to defecate should be encouraged to restore natural and normal bowel movements.
Which instructions should the nurse include when providing discharge instructions to a client diagnosed with peripheral arterial disease? 1. Encourage the client to use a heating pad on the lower extremities. 2. Demonstrate to the client the correct way to apply an elastic support hose. 3. Instruct the client to walk daily for at least 30 minutes. 4. Tell the client to check both feet for red areas at least once a week. The correct answer is 3. Instruct the client to walk daily for at least 30 minutes. Walking promotes the development of collateral circulation to ischemic tissue and slows the process of atherosclerosis. External heating devices are avoided to reduce the risk of burns. An elastic support hose reduces the circulation to the skin and are avoided. The feet must be checked daily, not weekly. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse instructs the client who has had a hemorrhoidectomy not to use sitz baths until at least 12 hours post-operatively to avoid inducing which of the following complications? 1. Hemorrhage. 2. Rectal spasm. 3. Urine retention. 4. Constipation. The correct answer is 1. Hemorrhage. Applying heat during the immediate post-operative period may cause hemorrhage at the surgical site. Moist heat may relieve rectal spasms after bowel movements. Urine retention caused by reflex spasm may also be relieved by moist heat. Increasing fiber and fluid in the diet can help prevent constipation.
A client with microcytic anemia is having trouble selecting food from the hospital menu. Which food is best for the nurse to suggest for satisfying the client's nutritional needs? 1. Egg yolks. 2. Brown rice. 3. Vegetables. 4. Tea. The correct answer is 2. Brown rice is a source of iron from plant sources. Other sources of non-heme iron are whole grain cereals and breads, dark green vegetables, legumes, nuts, dried fruits, oatmeal, and sweet potatoes. Egg yolks have iron, but it is not as well absorbed as iron from other sources. Vegetables are a good source of vitamins that may facilitate iron absorption. Tea contains tannin, which combines with non-heme iron, preventing its absorption.
The client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? 1. Bronchospasm. 2. Nausea. 3. Fever. 4. Drowsiness. The correct answer is 1. Bronchospasm. Acetylcysteine is a mucolytic. Mucomist can cause bronchospasm, which will impair the client's breathing, not improve it. An adverse reaction is a reason to immediately discontinue the medication. Nausea is a side effect of many medications and can usually be managed by taking the medication with food. A side effect is not an adverse effect. Fever would result from the cold, flu, or infection, not from the medication. Drowsiness is caused by some cold and flu preparations, usually antihistamines. Mucomist causes the client to expectorate secretions, which will keep the client awake. A mother, 1 day postpartum from a 3-hour labor and a spontaneous vaginal delivery, questions the nurse because her baby's face is purple. Upon examination, the nurse notes petechiae over the scalp, forehead, and cheeks of the baby. The nurse's response should be based on which of the following? 1. Petechiae are indicative of severe bacterial infections. 2. Rapid deliveries can injure the neonatal presenting part. 3. Petechiae are characteristic of the normal newborn rash. 4. The injuries are a sign that the child has been abused. The correct answer is 2. Rapid deliveries can injure the neonatal presenting part. When neonates speed through the birth canal during rapid deliveries, the presenting parts become bruised. The bruising often takes the form of petechial hemorrhages. Petechiae can be present as a result of an infectious disease, for example, meningococemia. In this situation, however, there is no indication that an infection is present. Erythema toxicum, the newborn rash, is characterized by papules or pustules on an erythematous base. There is nothing in the scenario to suggest that child abuse has occurred. Although this question is about the neonate, the key to answering the question is knowledge of the normal length of a vaginal labor and delivery. Multiparous labors average about 8 to 10 hours, and primiparous labors can last more than 20 hours. The 3-hour labor noted in the stem of the question is significantly shorter than the average labor. The neonate, therefore, has progressed rapidly through the birth canal and, as a result, is bruised. Which statement is the scientific theory for prescribing zinc preparations for a client with a cold? 1. Zinc binds with the viral particle and reduces the symptoms of a cold. 2. Zinc decreases the immune system's response to a virus. 3. Zinc activates viral receptors in the body's immune system. 4. Zinc blocks the virus from binding to the epithelial cells of the nose. The correct answer is 4. Zinc blocks the virus from binding to the epithelial cells of the nose. Theoretically, zinc blocks viral binding to nasal epithelium. Observation has shown that increased amounts of zinc can prevent the binding and prevent the development of symptoms of the rhinovirus. Zinc does not bind the viral particle. Symptoms are diminished by blocking the ability of the virus to bind with the nasal lining. Zinc is a micronutrient found in the body that helps to increase the body's immune system. Activating viral receptors would increase the symptoms of a cold.
A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 2. Hyperkalemia. 3. Impotence. 4. Pancreatitis. 5. Sleep disturbance. The correct answers are 1, 3, and 5. Clonidine is a central-acting adrenergic antagonist. It reduces sympathetic outflow from the central nervous system. Dry mouth impotence and sleep disturbances are possible adverse effects. Hyperkalemia and pancreatitis are not anticipated with use of this drug.
A nurse notes that a 6-hour-old neonate has cyanotic hands and feet. Which of the following actions by the nurse is appropriate? 1. Place the child in an isolette. 2. Administer oxygen. 3. Swaddle the baby in a blanket. 4. Apply pulse oximeter. The correct answer is 3. Swaddle the baby in a blanket. The baby's extremities are cyanotic as a result of the baby's immature circulatory system. Swaddling helps to warm the baby's hands and feet. There is no evidence in the STEM that would warrant placing the child in an isolette. Cyanotic hands and feet are not signs of hypoxia in the neonate. There is no evidence in the STEM that would warrant monitoring with the pulse oximeter. You must be familiar with the differences between normal findings of the newborn and those of an older child or adult. Acrocyanosis, which is bluish cyanotic hands and feet, is normal in the very young neonate resulting from his or her immature circulation to the extremities. The client diagnosed with emphysema is admitted to the surgical unit for a cholecystectomy. Which post-operative interventions should the nurse implement? Select all that apply. 1. Have the patient turn, cough, and breathe deeply every 2 hours. 2. Administer oxygen to the client at 4 liters per minute. 3. Assess the surgical dressing every 4 hours. 4. Medicate frequently with morphine 15 mg IV push. 5. Use the incentive spirometer every 4 hours. The correct answers are 1. Have the patient turn, cough, and breathe deeply every 2 hours. 3. Assess the surgical dressing every 4 hours. And 5. Use the incentive spirometer every 4 hours. Clients undergoing surgery are encouraged to turn, cough, and deep breathe a minimum of every 2 hours. Clients diagnosed with chronic lung disease are frequently prescribed long-term steroid therapy. Steroids delay wound healing. The nurse should assess the wound to determine that the surgical incision is healing as desired. The client should use the incentive spirometer to help prevent pneumonia. Every 4 hours is an appropriate time span. The client should be administered oxygen at 1 to 3 liters per minute. Clients with chronic lung disease have developed carbon dioxide narcosis. High levels of carbon dioxide have destroyed the client's first stimulus for breathing. Oxygen hunger is the body's backup system for sustaining life. Administering oxygen at levels above 2 liters per minute at rest and 3 liters per minute during activity may cause the client to stop breathing.
The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? 1. Mix green salad with blue cheese dressing, crackers, and cold cuts. 2. Ham sandwich on rye bread and an orange. 3. Baked chicken, an apple, and a slice of white bread. 4. Hot dogs, baked beans, and celery and carrot sticks. The correct answer is 3. Processed and cured meat products, such as cold cuts, ham, and hot dogs, are all high in both fat and sodium and should be avoided on a low-calorie, low-fat, low-salt diet. Dietary restrictions of all types are complex and difficult to implement with clients who are basically asymptomatic.
The parent of a newborn asks, "Will my baby spit out the formula if it is too hot or too cold?" Which is the nurse's best response? 1. Babies have a tendency to reject hot fluids, but not cold fluids, which could result in abdominal discomfort. 2. Babies have a tendency to reject cold fluids, but not hot fluids, which could result in esophageal burns. 3. Your baby would most likely spit out formula that was too hot, but your baby could swallow some of it, which could result in a burn. 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. The correct answer is 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. Swallowing is a reflex in neonates. Infants younger than 6 weeks cannot voluntarily control swallowing. The infant is not capable of selectively rejecting fluid because swallowing is a reflex until 6 weeks. You should eliminate answers 1, 2, and 3 because they suggest that the infant is capable of selectively rejecting fluids. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with gastroesophageal reflux disease? 1. PPI medications neutralize the gastric secretions. 2. PPI medications block H2 receptors on the parietal cells. 3. PPI medications inhibit the enzyme that generates gastric acid. 4. PPI medications form a protective barrier against acid and pepsin. The correct answer is 3. PPI medications inhibit the enzyme that generates gastric acid. PPIs inhibit the enzyme that generates gastric acid. Antacids, not PPIs, neutralize gastric secretions. H2 blockers block receptors on the parietal cells. Mucosal barrier agents form a protective barrier against acid and pepsin.
The client realizes the importance of quitting smoking, and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? 1. Review the negative effects of smoking on the body. 2. Discuss the effect of passive smoking on environmental pollution. 3. Establish the client's daily smoking pattern. 4. Explain how smoking worsens high blood pressure. The correct answer is 3. A plan to reduce or stop smoking begins with establishing the client's personal daily smoking pattern and activities associated with smoking. It is important that the client understands the associated health and environmental risks, but this knowledge has not been shown to help clients change their smoking behavior.
The parent of a 5-year-old states that the child has been having diarrhea for 24 hours, vomited twice 2 hours ago, and now claims to be thirsty. The parent asks what to offer the child because the child is refusing Pedialyte. Which is the nurse's most appropriate response? 1. You can offer clear diet soda such as Sprite and ginger ale. 2. Pedialyte is really the best thing for your child, who, if thirsty enough, will eventually drink it. 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. 4. It really does not matter what your child drinks as long as it is kept down. Try offering small amounts of fluids in medicine cups. The correct answer is 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. Pedialyte is the first choice, as recommended by the American Academy of Pediatrics. Offering the child appropriate choices may allow the child to feel empowered and less likely to refuse the Pedialyte. Small, frequent amounts are usually better tolerated. When Pedialyte is not tolerated, it is usually recommended that clear sodas and juices be diluted. Diet beverages are not recommended because the sugar is needed to help the sodium be reabsorbed. Pedialyte is the best choice. If the child is not encouraged to drink Pedialyte, the child may become severely dehydrated. Other ways to encourage oral rehydration need to be considered. Offering small amounts of liquids is important. The type of beverage does matter because many fluids may increase vomiting and diarrhea. You should eliminate answer 2 because it offers an ultimatum to a child. The child is likely to refuse the Pedialyte, worsening the state of dehydration. The nurse is discharging a client diagnosed with gastroesophageal reflux disease. Which information should the nurse include in the teaching? 1. There are no complications of gastroesophageal reflux disease as long as you take the medications. 2. Notify the HCP if the medication does not resolve the symptoms. 3. Immediately after a meal, lie down for at least 45 minutes. 4. If any discomfort is noted, take an NSAID for the pain. The correct answer is 2. Notify the HCP if the medication does not resolve the symptoms. There may be several complications of gastroesophageal reflux disease. Adult-onset asthma and Barrett's esophagus leading to cancer of the esophagus are two complications of gastroesophageal reflux disease. The chance of developing these problems is less if the GERD is adequately treated, but there are no guarantees. The client should be instructed to sit upright for at least 60 minutes following a meal to prevent reflux from occurring. NSAIDs can increase gastric distress. Ulcers caused by NSAIDs use may be asymptomatic, or the symptoms may be attributed to the GERD. The client should use the prescribed H2 receptor blocker, PPI, or an antacid to relieve the discomfort associated with gastroesophageal reflux disease.
What question is a home health nurse most likely to ask the patient to evaluate the efficacy of cimetidine? 1. Are you still having problems with constipation? 2. Has the medication helped to relieve the acid indigestion? 3. Did the medication relieve the nausea and vomiting? 4. Do you feel like your appetite has improved? The correct answer is 2. Has the medication helped to relieve the acid indigestion? Rationale. Cimetidine is available over the counter and is used to relieve heartburn, acid indigestion, and sour stomach. A nurse in a clinic is caring for clients in a variety of age groups. Which age group should the nurse anticipate will have the highest potential to demonstrate regression when ill? 1. Infants. 2. Toddlers. 3. Adolescents. 4. Young adults. The correct answer is 2. Toddlers. Rationale. Toddlers are less able to understand and interpret what is happening to them when ill. Therefore, they commonly regress to a previous level of development in an attempt to reduce anxiety. Infants already demonstrate behavior on the most basic level. Adolescents generally want to behave in an adult manner and therefore demonstrate a controlled behavioral response to illness. Although some young adults may regress to an earlier level of development as a coping strategy, regression commonly is not used as a defense mechanism when coping with illness.
The nurse is caring for an infant diagnosed with Hirschsprung disease. The mother states she is pregnant with a boy and wants to know if her new baby will likely have the disorder. Which is the nurse's best response? 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. 2. There is no evidence to support a genetic link, so it is very unlikely the baby will also have it. 3. It is rarely seen in boys, so it is not likely your new baby will have Hirschsprung disease. 4. Hirschsprung disease is seen only in girls, so your new baby will not be at risk. The correct answer is 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. There is a genetic component to Hirschsprung disease, so any future siblings are also at risk. Hirschsprung disease is seen in both males and females, but is more common in males. You can eliminate answers 3 and 4 because they are similar and therefore would not likely be the correct answer. The client diagnosed with inflammatory bowel disease, taking mesalamine reports, nausea, vomiting, and diarrhea. Which intervention should the clinic nurse take? 1. Instruct the client to quit taking the medication immediately. 2. Tell the client to take lansoprazole with the medication. 3. Advise the client to keep taking the medication, but notify the HCP. 4. Explain that these symptoms are expected and will resolve with time. The correct answer is 3. Advise the client to keep taking the medication, but notify the HCP. Mesalamine is an aspirin derivative. These are side effects of the medication, and the HCP should be notified, but the client should not stop taking the medication. The client should not quit taking the medication abruptly because that would result in an acute exacerbation of the inflammatory bowel disease. Lansoprazole is a PPI. A PPI will not help treat these symptoms. These symptoms will not resolve with time and should be reported to the HCP.
A patient underwent an exploratory laparotomy 2 days ago. The healthcare provider should be called immediately for which assessment finding? 1. Abdominal distension and rigidity. 2. Absent or hypoactive bowel sounds. 3. Nausea and occasional vomiting. 4. Displacement of the nasogastric tube. The correct answer is 1. Abdominal distension and rigidity. Rationale. Distension and rigidity can signal hemorrhage or peritonitis. The HCP may also decide that these symptoms require medication to stimulate peristalsis. Absence of bowel sounds is expected within the first 24 to 48 hours. Nausea and vomiting are not uncommon and are usually self-limiting, and an as-needed prescription for an antiemetic is usually part of the routine postoperative care. The NG tube should be assessed for displacement, and the correct position of the tube must be confirmed. The nurse then secures the tube as necessary. The nurse is caring for a patient who was recently admitted for severe diverticulitis. Which task is appropriate to delegate or assign for the care of this patient? 1. Tell the unit secretary to call radiology and schedule a barium enema. 2. Ask the LPN/LVN to give as needed laxatives for constipation. 3. Instruct the nursing student to help the patient ambulate up and down the hall. 4. Tell assistive personnel to save a stool specimen to test for occult blood. The correct answer is 4. Tell assistive personnel to save a stool specimen to test for occult blood. Rationale. Diverticulitis can cause chronic or severe bleeding, so if there is no obvious blood in the stool may be tested for occult blood. A barium enema is not usually ordered because of the danger of perforation. Laxatives and ambulation increase intestinal motility and are to be avoided in the initial phase of treatment. If a barium enema, PRN laxative, or ambulation is prescribed, the nurse should check with a healthcare provider before delegating or assigning the intervention.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
After a nasogastric tube is inserted, which assessment finding is cause for greatest concern? 1. The patient reports that the tube is irritating nose and throat feels sore. 2. Gastric contents have a coffee ground appearance. 3. The patient demonstrates coughing and cannot speak clearly. 4. Gastric fluid is bright red and has small clots. The correct answer is 3. The patient demonstrates coughing and cannot speak clearly. Rationale. Coughing and an inability to speak or difficulty in speaking clearly suggests that the tube has been inserted into the trachea. The tube should be removed immediately. Bright red blood with clots indicates active bleeding. This should be immediately reported to the healthcare provider. Coffee ground appearance of gastric contents indicates old blood. This finding should also be reported but is less urgent. Irritation of the throat and around the nares is commonly reported. Perform hygiene around the nares as needed. Irritation of the throat usually subsides, but an anesthetic throat spray may offer some temporary relief. The patient with advanced cirrhosis has massive ascites, peripheral dependent edema in the lower extremities, nausea and vomiting, and dyspnea related to pressure on the diaphragm. Which indicator is the most reliable for tracking fluid retention? 1. Auscultating the lung fields for crackles every day. 2. Measuring the abdominal girth every morning. 3. Performing daily weights with the same amount of clothing. 4. Checking the extremities for pitting edema and comparing with baseline. The correct answer is 3. Performing daily weights with the same amount of clothing. Rationale. All of these measures should be performed for total care of the patient. However, weighing the patient every day is considered the single best indicator of fluid volume. A patient with end-stage liver disease is talking to the nurse about being on the transplant list. Which statement by the patient is cause for greatest concern? 1. I have a family history of diabetes. 2. I had symptoms of asthma when I was a kid. 3. I guess I should cut back on my alcohol consumption. 4. I am not very good about taking prescribed medication. The correct answer is 3. I guess I should cut back on my alcohol consumption. Rationale. If alcohol abuse has contributed to liver failure, a person's intent to continue alcohol consumption might be an exclusion for a liver transplant, so the nurse should conduct an additional assessment about this comment. The comment about the difficulty in taking prescription medications should also be investigated because a true inability to follow the treatment regimen could exclude a patient from being on a transplant list.
Which statement best describes the scientific rationale for prescribing metformin? 1. This medication decreases insulin resistance, improving blood glucose control. 2. This medication allows the carbohydrates to pass slowly through the large intestine. 3. This medication will decrease the hepatic production of glucose from stored glycogen. 4. This medication stimulates the beta cells to release more insulin into the bloodstream. The correct answer is 3. This medication will decrease the hepatic production of glucose from stored glycogen. Metformin is a biguanide that works to prevent gluconeogenesis in the liver. The scientific rationale for administering metformin is that it diminishes the increase in serum glucose following a meal and blunts the degree of postprandial hyperglycemia by preventing gluconeogenesis. A thiazolidinedione, pioglitazone, or rosiglitazone, not a biguanide like metformin, is prescribed to decrease insulin resistance. An alpha-glucosidase inhibitor, acarbose or miglatol, is administered to allow carbohydrates to pass slowly through the intestine. Glucophage does not do this. Meglitinide, repaglinide, sulfonylurea, or natglinide is prescribed to stimulate the beta cells to release more insulin into the bloodstream.
Which activity is an example of an intervention associated with secondary healthcare delivery? Select all that apply. 1. Conducting a cardiac risk assessment for middle-aged adults. 2. Teaching a low-fat diet to a person with high cholesterol. 3. Immunization of a child during the first year of life. 4. Providing a class on smoking cessation. 5. Monthly breast self-examinations. The correct answer is 5. Monthly breast self-examinations. Rationale. Monthly breast self-examinations are associated with secondary healthcare services because they are concerned with detection of breast cancer. Option 1 is a primary, not secondary, healthcare delivery. Risk assessments for specific diseases are included in primary healthcare services. Primary healthcare services are concerned with generalized health promotion and specific protection against disease. In option 2, a low-fat diet generally is part of a medical management program for a person who is overweight or who has high cholesterol. This is a tertiary, not secondary healthcare service. Tertiary healthcare services are associated with attempts to reduce the extent and severity of a health problem in an effort to limit disability, as well as restore and maintain function. In option 3, administering an immunization is a primary, not secondary healthcare service. Primary healthcare services include protecting people from disease. Providing a class on smoking cessation is associated with primary, not secondary healthcare. Primary healthcare is associated with health promotion and illness prevention.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.